We've been talking a little COVID this morning, but there are questions about whether it's COVID that you have, Omicron, or whether it's just maybe a cold. And
maybe you just got the shakes.
Could be something like that. You just never know. We've called Dr. Fahmy Farah to join us and kind of tell us a little bit about, Dr. Farah has dealt with I don't know how many COVID patients, but maybe tell us a little bit about some of the symptoms that are likely to be COVID and what you should do about them. Dr. Farah, thank you for your time.
Hey, thanks for having me.
Glad to do it. Glad to have you on. I think everybody gets a little bit concerned when they start getting the sniffles or they start getting a bad scratchy throat or something. Is it going to lead to just a cold, or how do you know the difference if you have Omicron COVID versus just something else?
The symptoms could actually be very similar with Omicron COVID versus a common cold versus the flu. One of the things, though, with Omicron, a lot of people are having is loss of smell and taste. That could be one of the symptoms that could differ a little bit from some of the other ones. But in general, with Omicron, people are also having high fever, 101, 102 fever. So those are some of the symptoms. A lot of fatigue. Some people are having GI symptoms as well, like nausea, vomiting, diarrhea. But a lot of these symptoms can coincide with other forms of viral illnesses like cold and flu. So for this reason, it's very important to get tested.
What about COVID patients like myself and my wife? We tested positive 3 days before Christmas. On the same day, we cleaned out our garage and our backyard and took it to a dump. I had no idea. I had zero symptoms, nothing.
Yeah, there are a lot of people who are asymptomatic, and they're known as the asymptomatic carriers because they don't know they have it, and as a result, they don't know to isolate themselves, and they could be spreaders. And that's the reason why it's so important for people to wear masks and whenever they're going out in public, because we don't know who has it and who don't for that reason.
Dr. Fahmy Farah is with us. She's a medical specialist and worked with countless COVID patients. Dr. Farah, once again, welcome to the program. And you talked about wearing a mask. This is one of the most confusing things for me to understand. At the very beginning of this, I've been told that the only mask that can do any good is the N95. And you very rarely see people wearing an N95 mask. Me personally, I can wear one for about 10 minutes. So does a mask do any good, or is it mentally doing some good?
Masks, definitely, they help prevent spread the virus, because they prevent spreading of the droplets. When you have a barrier on your face, it does do prevention, especially if both people are wearing masks, you and the person who's in front of you. As far as the N95 mask goes, it is something we still use in the hospital to treat patients who are actually COVID positive because it's a lot more protective than a regular surgical mask. But for the public, for us, when we go to crowded area where we have a lot of people, even a surgical mask can be very protective. Imagine someone without a mask coughing, and the amount of droplet that the other person who's not wearing a mask will be inhaling. The amount of that is a lot less for if both of those were to be wearing masks.
So a general rule then, a mask is going to help in some form or fashion. It will help.
It will help in some form and fashion, yes, that is correct.
Dr. Fahmy Farah with us on News Talk 820 WBAP. I've heard people talk about Omicron being the mild version, and yet you do hear that there are people being hospitalized with it. And I've also heard stories of folks saying, I think I'm just going to get this and get it over with, and like it's the measles or something like that, or a pox party. That doesn't strike me as necessarily being the smartest thing to do, and I don't know how we define mild anymore. I thought maybe you could.
Yes, I completely agree that people should definitely not have the attitude of getting the virus on purpose to get it over with. It is most definitely not like the measles. They can get it again. And as far as the symptoms go, mild could mean just as mild as like a simple cold. They won't even have fever, very high fever, maybe just low-grade fever, runny nose, sore throat. That would be mild symptoms. And most people who are having severe illness from Omicron and are ending up in the hospital, more than 95% of them are the unvaccinated folks that we're seeing at the moment.
Dr. Farah, this is a question this has been puzzling me ever since we first heard the word coronavirus, and that is this, that we know about folks who have underlying conditions, and they're going to suffer much more than others. But you do hear stories of people who are healthy with no underlying conditions, and COVID can kill them. And then the guy next door has the same case of COVID, and it's a cold, and back at work 5 days later. Why is there such a disparity in how COVID treats different people?
Yes, there is definitely a spectrum when it comes to COVID, and we really don't know who is going to be affected in which way. We do know, as you mentioned, those who have comorbidities such as high blood pressure, diabetes, heart conditions, they are more prone to being more sick just because their body can handle less. COVID can have a very severe inflammatory response. And those with diabetes, for example, their bodies are considered somewhat weak to begin with, and they tend to get more sick. Those who have pre-existing coronary disease, if they have blockages, for example, viral illness can destabilize that blockage and cause them to have a heart attack. For those reasons, those who have comorbidities are usually more predisposed to having being high risk, so to speak. But you're correct. There are some people who have those pre-existing conditions and still have very mild case, and there are some who have nothing, no pre-existing conditions. They could even be young. We've had people who are 20-year-olds who've been in the hospital in the ICU and even died from COVID. So it's difficult to say why COVID has such a varied response from individual to individual. It could be the viral load, the amount of virus they have. That's one of the reasons that could be the case.
This is Dr. Fahmi Farah, a medical specialist, worked with countless COVID patients. There's so much information out there that many more questions. We'll definitely have to have you back. Dr. Farah, thank you so much for your time on WBAP this morning.
Thank you for having me.